In this video, Professor Margaret explains the 4 types of shock in detail. If you have not already done so, be sure to watch our other video, Shock Part 1, in which she gives you an overview of shock in general.
This second video on shock will cover the 4 types of shock: cardiogenic shock, hypovolemic shock, obstructive shock, and distributive shock. At the end of the video, your completed map will look like this. So let's get started with our blank map so that you can follow along. Cardiogenic shock will be the first shock that we cover. The hallmark of cardiogenic shock is that the preload or fluid volume is increased in the body and the cardiac output is decreased. This is due to the heart pump failure. Frequent causes of cardiogenic shock include myocardial infarction, cardiomyopathy, severe dysrhythmias, and end-stage heart failure. In these cases, what we have is left ventricular pump failure. When the left ventricle fails or is no longer able to pump, then blood will start to back up into the lungs and will actually have symptoms of left-sided heart failure. So manifestations of cardiogenic shock will include decreased blood pressure, decreased cardiac output, and an increase in heart rate as the body tries to compensate and deliver blood to the body. Because of the heart pump failure, patients will have weak pulses, maybe cyanosis or pale extremities, and they also will have symptoms of left-sided heart failure, such as pulmonary edema or congestion in the lungs. With cardiogenic shock, because you have a decrease in the cardiac output, you actually are sending less blood flow to the kidneys. When you do that, you end up decreasing urine output, and it actually starts what we call the RAS system. This RAS system leads to increased fluid retention and increase in preload and fluid volume. Hypovolemic shock is characterized by a decreased preload or fluid volume and decreased cardiac output because of the lack of fluid volume or low blood volume. Common causes of hypovolemic shock include hemorrhage, severe dehydration, and significant burn injury. When patients suffer significant burns, it actually causes them to lose large amounts of fluid volume and they become very hypovolemic. With hypovolemic shock, there's inadequate blood volume that results in the decreased cardiac output, and so there's not enough cardiac output to meet the needs of the body. Manifestations of hypovolemic shock may start to be seen when there's 15 to 20% of the body's blood volume lost. The manifestations of hypovolemic shock include decreased urine output, decreased blood pressure, and increased heart rate as the body tries to compensate and increase blood flow to the extremities. In addition, you're going to see all the symptoms of fluid volume deficit or dehydration. These symptoms include thirst, dry mucous membranes, decreased skin turgor, and even increased capillary refill time. Now let's talk about obstructive shock. Obstructive shock is the least common shock. In obstructive shock, the heart is unable to fill with blood due to outside compression of the heart. The hallmark characteristics include decreased preload and decreased cardiac output. Common causes of obstructive shock include pulmonary emboli, cardiac tamponade, and even tension pneumothorax. What happens in obstructive shock is that there's an actual mechanical obstruction or compression of the heart that restricts the heart from being able to fill. If the heart cannot fill, then it obviously can't pump cardiac output. Manifestations include decreased cardiac output, decreased urine output from not enough renal blood flow, and actually signs of right-sided heart failure. Because the heart cannot fill, blood actually starts to back up in the periphery. Last, you may also notice that heart sounds become more muffled and harder to hear. Correcting the compression and allowing the heart to fill will correct obstructive shock. Distributive shock is a bit different from the other three shocks. With distributive shock, there is an extreme decrease in systemic vascular resistance, also known as blood pressure. This results in severe vasodilation. The vessels become so dilated and so widened that there is no possible way to have enough cardiac output to fill them. Although there is a decent amount of cardiac output because the heart is able to pump, the severe vasodilation of the vessels makes it almost impossible to fill them up to obtain an appropriate blood pressure. Basically, there's a relative lack of cardiac output due to this expanded vascular space. And really what it leads to is hypovolemia because the heart just can't pump enough blood to fill up the blood vessels. Now there are three types that fall into distributive shock: anaphylactic shock, neurogenic shock, and septic shock. Anaphylactic shock is an allergic reaction. And that results in a massive release of histamine. This massive histamine release leads to hypotension, also known as decreased SVR or decreased blood pressure. Along with this hypotension, you will also see other symptoms such as laryngeal swelling, and wheezing. This is why epinephrine or EpiPens work well. Neurogenic shock is actually loss of sympathetic activation. This loss of sympathetic activation is often due to a spinal cord injury. In a spinal cord injury, there's damage to the nerves that control blood vessel tone, and this results in the decreased blood pressure or hypotension, an altered heart rate, and also altered thermoregulation. The last is septic shock, and this is probably the most common type of distributive shock seen in the hospital setting. In septic shock, there is severe systemic inflammation. And this severe systemic inflammation leads to an abnormal distribution of blood in the body. So basically, blood is going to the wrong locations. What we see is blood actually goes to the extremities. And really, blood should be going to the vital organs, the brain, the heart, the kidneys, but instead, blood is sent to the extremities. What we see also is that an inflammatory cascade is stimulated, and that results in edema and vascular leakage of blood, causing petechiae and even purpura. Now remember, purpura and petechiae are actually bleeding or bruising under the skin. Extremities become very warm, and septic shock frequently leads to DIC, acute renal failure, and multi-organ dysfunction syndrome. And here's your completed map. Thank you for listening today, and if you found the video helpful, please like and subscribe.